Welcome to the Omni Dental Podcast. You've tuned into The Deep Dive, the show where we take your questions and sources and distill them into essential knowledge. Today, we're tackling a question, one many of us ask, but maybe don't fully explore. How often should you visit the dentist?
Right.
It seems simple, but there's actually a lot more to it, isn't there? It's quite individualized.
Exactly. It's not just a number.
We've been diving into some really insightful material, including info straight from Omni Dental and a great piece digging into regular dental checkups.
And what's really fascinating, I think, is how often we overlook the why behind these visits. It's so much more than just getting your teeth cleaned. It's like a window into your overall health.
Yeah.
And understanding individual needs, that's key. We'll try and connect those dots today.
Perfect. And just to give us some context, we'll also briefly touch on Omni Dental itself, who they are, where they are, the kind of care they offer. Okay, let's unpack this, get into the surprising facts, the crucial insights, help you stay informed about your oral health. So before we really dive deep on, how often to go, let's quickly introduce Omni Dental. What can you tell us about this practice? Give us the basics.
Sure. So Omni Dental, they're located at 305 East Rand Road in Arlington Heights, Illinois. Their whole focus is really on top-tier dental care, addressing immediate needs, yes, but also looking at long-term health.
Okay.
And they serve Arlington Heights, obviously, but also the nearby communities, places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DePlain, and Elk Grove Village, too.
Wow, that covers quite a bit of ground. And who's leading the team there?
That would be Dr. Billis Poles, DDS. He's got over a decade of experience and really specializes in treating a whole range of things, dental injuries, emergencies, very precise work. But their approach, it's very patient-centered. They really try to treat patients like family, making sure everyone, from little kids, toddlers, right up to seniors, gets care that's tailored and, respectful.
That patient-first idea sounds, essential, really, especially in healthcare. What kind of services are we talking about? What do they actually offer?
Oh, it's a pretty full range. You've got your general dentistry, things like deep teeth cleaning, sealants, those protective coatings, fillings, root canals, extractions. The fundamentals.
Right.
Then there's comprehensive cosmetic dentistry. Think Invisalign, teeth whitening, smile makeovers, dental bonding. And they also handle more advanced treatments, things like dental implants, even full arch implants, and laser therapy for gum disease, plus prosthodontics like dentures. And interestingly, they also offer aesthetic services, Botox, fillers, laser hair removal, skin rejuvenation. They kind of leverage their knowledge of facial anatomy for overall well-being.
That's quite comprehensive. Almost sounds like a one-stop shop. So what really sets them apart in how they do things beyond just the list, I mean?
I'd say it's their emphasis on personalized treatment plans, making sure it fits the patient, Also, making appointments comfortable, trying to reduce that stress factor that, let's be honest, many people feel about the dentist. And they use a lot of cutting-edge tech, advanced technology for more precise and efficient care. Oh, and they're also committed to sustainable practices, minimizing environmental impact. That's something more people are looking for now, too.
Good to know. And their hours.
They're open Monday to Friday, 10 a.m. to 6 p.m., closed weekends.
Got it. Okay, now let's pivot to our main topic. Why do regular dental checkups really matter? It feels routine, but the sources suggest it's much, much deeper.
Yeah, this is such an important question. We tend to think, just a cleaning. Right. But these routine visits are absolutely crucial for prevention and early detection. We're talking preventing serious stuff, cavities, sure, but also gum infections, other oral diseases. And here's the kicker. Your mouth really is a window to your overall health. Dentists can spot signs of things like diabetes, vitamin deficiencies, even oral cancer.
Wow. Okay, that's where it gets really interesting, isn't it? Detecting something like oral cancer early, that's life-saving.
Absolutely.
So it's not just about having a bright smile. It's fundamentally about your health, your well-being.
Precisely. It's interconnected. For example, severe gum disease. It can actually make it harder for someone with diabetes to control their blood sugar. It works both ways.
That's a powerful connection. Okay, so given how important this is, what's the general rule? How often should most of us be sitting in that dental chair?
Well, the general guideline, the one you hear most often, is every 6 months.
Twice a year.
Twice a year, yeah. For most people who, practice good oral hygiene at home and don't have major ongoing issues, that's usually a good starting point.
But you mentioned earlier it's not always that simple. What about people with, say, ongoing problems or specific health conditions? Does that 6-month rule change?
Oh, absolutely. And this is where that personalization really kicks in. Some folks might need to come in every 3 or 4 months.
Really? That often?
Yes.
Mm.
Think about people with a history of dental problems, maybe recurring cavities or gum disease,
Mm.
especially if it's more advanced. Also, people with certain chronic health conditions like diabetes, as we mentioned, they might need more frequent monitoring.
Okay.
And kids and seniors often fall into this category too.
Mm.
Kids have developing teeth. Seniors might face issues like dry mouth or root decay,
Yeah.
age-specific stuff. So the key takeaway really is the how often depends entirely on your specific dental health needs and your risk factors.
So just assuming 6 months isn't always the right move.
Exactly. And, skipping appointments for, say, more than a year, that significantly bumps up your risk of problems developing or getting worse.
Right. So for someone who might be a bit nervous, maybe they haven't been in a while, what actually happens during a typical checkup? Walk us through it.
Sure. So during a routine checkup, the dentist does a really thorough exam. They look at your teeth, obviously, but also your gums, your tongue, the roof of your mouth, inside your cheeks. The whole picture. They're looking for any early signs of trouble, tooth decay, gum inflammation, little red flags, and they'll do an oral cancer screening.
Okay. And the cleaning part.
Yep, you'll get a professional teeth cleaning. Because even if you're like super diligent with brushing and flossing at home,
Which we should be.
absolutely. But even then, plaque, that sticky film can build up. And if it hardens, it becomes tartar. Tartar's tough stuff. You can't brush it away yourself. It usually collects in those hard-to-reach spots.
Ah.
So the professional cleaning gets rid of that plaque and tartar buildup. It helps prevent cavities and gum disease before they even start, ideally.
Makes sense. What about x-rays? Do they happen every time?
Not necessarily every single time, but they're a really important part of the checkup periodically. X-rays let the dentist see things that aren't visible just by looking, like cavities starting between your teeth, or maybe problems happening below the gum line, around the roots, hidden issues.
So the checkup is pretty comprehensive then. Examination, cleaning, maybe x-rays?
Exactly. It's a multifaceted approach to catch things early and keep you healthy.
Okay, it sounds like the dentist visit is crucial, no doubt. But what about the time between visits? How important is our daily routine at home?
Oh, it's huge. I'd say it's just as important, maybe even more so in some ways. Think of it like this. The checkups are periodic maintenance and inspection, but the daily care. That's the foundation.
Right.
Brushing twice a day properly for 2 minutes. Flossing daily to clean between the teeth where the brush misses. Maybe using mouthwash if your dentist recommends it. And, watching the sugary snacks and drinks. Those are fundamental.
So it's a partnership, really, what you do at home and what the dentist does.
Absolutely. If you're really on top of your home care routine and you follow any specific advice your dentist gives you, well, then those twice-a-year checkups are likely going to be enough for most of your adult life. Good home care makes the professional visits more effective, more focused on prevention.
Okay, let's try and tie this all together. We've covered a lot: why visits matter, how often, what happens, the role of home care. Let's quickly hit some common questions people might still have. First, just to reiterate, how often do you really need to go?
Okay, bottom line. Most people, every 6 months. But, and this is the important part, some need more frequent checkups. Depends on your oral health, your medical history. Listen to your dentist's recommendation for you.
And how long can someone realistically go without seeing a dentist? Is skipping a year really that bad?
You really shouldn't wait more than a year. I know life gets busy, but skipping those appointments significantly increases your risk. Small problems can become big problems much faster than you might think. Dental disease doesn't wait.
Okay. And the every 3 months thing, some people genuinely need that.
Yes, absolutely some do.
Mm-hmm.
If you have active gum disease, for instance,
Mm-hmm.
or maybe you're undergoing certain treatments like orthodontics or implants, your dentist might very well recommend coming in every 3 or 4 months to keep things stable and progressing well. It's tailored care.
So wrapping this up, what's the main message for our listeners?
Ultimately, I think the main message is that making regular dental checkups a non-negotiable part of your health routine is just vital. It's your best strategy to avoid serious, painful, and often expensive dental problems down the road. It supports your overall health, not just your teeth. It's truly about being proactive.
Yeah, it really seems clear. Whether it's that standard 6 months or maybe more often based on your own situation and what your dentist advises, staying on top of those appointments is just key. key for a lifetime of good oral health.
Hmm.
And knowing this, it kind of empowers you, doesn't it, to take control of this important part of your health.
Exactly. And think about the confidence that comes with good oral health. It affects so much how you eat, how you speak, how comfortable you feel just smiling.
Yeah.
It's a real investment in your quality of life, not just a chore to get through.
That's a fantastic thought to leave everyone with. An investment, not just an appointment. So, if this deep dive has maybe prompted you to think, when was my last visit? Or if you're looking to establish that personalized care plan, Omni Dental in Arlington Heights, IL, is ready to help. You can reach them at 847-483-8833, or you can schedule an appointment online pretty easily. Thank you so much for joining us for this deep dive today. We really hope it's giving you some valuable insight into keeping your smile bright and, more importantly, healthy for years to come.